what's it called? What we discussed earlier on. So what we discussed earlier on was we discussed about, yeah, those are the things we discussed about, the Tishizuma, Hematobium, and Sonia and Japonicum. So I was just talking about the urogenital form. So I want to discuss about the symptoms. So Dr. Ike said for the urogenital form, there could be what you call dysuria. Apart from dysuria, what other thing can we see? Apart from dysuria, doctors, let's hear from
hematuria, maybe.
Hematuria, of course, hematuria. That's why they refer to it as. I think one doctor also joined us, Dr. Amina. I don't know where she is right now. So they refer to it as a female, a male who is having schistosomiasis. It's just like the male is menstruating. You understand? So just they call it like that. So it's called. I don't mean it's menstruating really. Just you get the joke. You understand what I'm? Yeah. So it's like we can have a hematuria. Apart from hematuria, what other thing, doctor? What about for the woman?
Maybe increased frequency.
Yeah, it could cause for the woman. It can cause vaginal bleeding also. It can result into vaginal bleeding. It can cause vaginal bleeding. Apart from that, it can even result into polyuria. Polyuria, the person urinates a lot, and it can even cause irregular menstruation in women. It can interfere with the menstruation, so it can result into what is called irregular.
Maybe erection.
What? Somebody is saying something.
John?
Eh? I can't hear. Hello?
Jaundice.
Jaundice. Jaundice. No, not really. Jaundice should be common with the intestinal form. Do you understand? Jaundice should be more common with the intestinal form. Do you understand what I mean, doctor? Jaundice, because in that case, there's something we call hepatosplenomegaly. Because there's inoculation in the liver, so it can cause it is from granuloma, so it can cause what is called jaundice. That is true. Bladder tenderness, yes, pains around the bladder, of course, pains around the bladder. It can even result into cancer. That will be a complication apparently. You understand? Erectile dysfunction could be a complication. Do you understand? So these are just the common symptoms you might probably see. Do you understand? Well, let's talk about the complication. Let's say complication. Complications. So what are the complications that you mostly see? Complication, if it is, let's say, the urogenital form, of course, there will be something like cystitis, carcinoma, cystitis. Do you understand? You can see things like cystitis, you can see cancer of the bladder. Apart from that, what other thing will you see? You can even result into renal failure. Don't forget. Renal failure. Apart from renal failure, doctor, what other thing do you think you can see? Somebody say erectile dysfunction. It can result into it can result into, let's say, infertility. Because there might be a problem with erection and the rest. You understand? What other things do you think we can see? It can affect the sperm. You see blood mixing up with the sperm. So it can result into hemospermia. You understand what I'm saying, doctor? So these are just the common thing you will see. These are the common stuff you will see. And apart from these complications, there are also complications of the intestinal form. So for the intestinal form, don't forget, I told you it goes to the liver. So it forms granuloma in the liver. So it can result into liver fibrosis. So liver fibrosis for the, let's say, complications for intestinal form. Intestinal form will result into what? Fibrosis. Like one doctor just left us. It can result into fibrosis. I mean liver fibrosis. It can result into liver fibrosis. Apart from liver fibrosis, what other thing do you think can result into? It can also result into cancer. Do you understand? It can cause intestinal cancer. Intestinal cancer. So apart from that, doctor, what other thing do you think
Intestinal
can?
cancer, not liver, right?
Yeah, it can cause liver cancer, but mostly there will be fibrosis in liver. But most cases, it will always be to be better intestinal cancer or colon cancer. I say colon
Okay.
cancer. So what other thing, doctor? What other thing do you think can result into intestinal form? It can result into malnutrition, and it can distort the intake of food by the patient. So there can be malnutrition. Malnutrition. Apart from malnutrition, you can see it can cause all these esophageal varices and the rest. So mostly these are the major complications apparently that you result. But don't forget, cancer is a very common complication of urogenital form. Portal hypertension, you are right, doctor. Can result into portal hypertension. Can result into portal hypertension. So those are the major these things. Yeah, you're correct, doctor. Liver failure, portal hypertension. You're correct. You're correct. Yeah. So these are just the major complication as a result of the urogenital form. Okay. So let's forge ahead about the treatment. How do we treat this each one? How do we treat them? The major treatment is using anti-emetic drug, and the major anti-emetic drug we use is praziquantel. You understand? That's the major anti-emetic drug they use. So treatment is the use of praziquantel. This is the drug of choice for treatment generally. But for each other one, there are other treatments. For example, for the schistosoma hematobium, some people use metclophenate. It's also used for the treatment. And also, why for the Mansonia, they use the oxalicoin. But I would suggest you just to know this one specifically. But there are other drugs they use. People use metclophenate and oxalicoin. But basically, praziquantel is enough. And I told you about the diagnosis earlier on. Like mostly diagnosis is you check for the exons too. And I told you how to differentiate each of the exons too. So the diagnosis is always you check for the exons too. And you know, once you know that, oh, this is this. Do you understand, doctors? And also don't forget, in summary, for the schistosoma, by now I believe you all know it, and probably there's no question about this schistosomiasis. I believe so. So we can move ahead. You can differentiate the eggs. And don't forget the urogenital form, also known as the vesicular hematobium. The urogenital form is known as the vesicular hematobium. All right, doctor.
Yeah,
So let's continue. So apart from the liver fluke, I told you how to diagnose it. Apart from the liver fluke, there are other groups of parasites we also need to check into. So there's also another groups of schistosomiasis, which are also known as the non-human schistosoma. Am I making sense? They are called non-human schistosoma. Non-human schistosoma. I'm not going to spend more time here, but all what I want you to know is that for the non-human schistosoma, they mostly is like this. What is not supposed to belong to human is now inside human. So it's always very weird. Okay. Normally, the non-human schistosoma always affect the birds. Okay. So now when they affect the birds, they can mature and affect, like, cause a different manifestation in the birds. But when man or human being get in contact with this non-human schistosoma, it infects the man. So after affecting the man, maybe man has a contact with water or something that there is presence of this schistosoma on it. So what it does is it penetrates the skin just the normal way they normally penetrate. But once the organism gets inside, it's a different environment totally. So it could not fully develop inside human. So what it causes, it will cause some reaction. It will cause itching. It will cause dermatitis. You understand? And mostly treatment is they give all this calamine lotion or you sedate the patient. Do you understand? So that is just that about the non-human schistosoma. You don't really actually have to know it, but it's just a point I want you to know. There is the human schistosoma, which is the one we discussed about. But the non-human schistosoma can also affect the human. Doctor, please, these are very important points I'm saying, and I want you to
Yeah.
note it, please. Okay? So let's continue. The next part we should know is the another group is the cystodas. They are very important groups. The cystodas. The cystodas, there are like 4 or 5 major microorganisms. Sorry, parasites we'll be discussing about. 4 or 5 major parasites we'll be discussing about, and I want you to pay proper attention to the cystodas. Okay, so for the cystodas, there are 4 or 5 major parasites. The first one we talk about is Taenia Solium, Taenia saginata, the Diphyllobatrum latum, Echinococcus granulosus, and Echinococcus multilocularis also. We're going to discuss about that. Those are the major ones you need to know ahead of your MDCN exam. Understand, doctor? Please, I need to put on
Yeah.
this. It's quite a bit hot here. Let me on this. Please, can you hear me? Can you still hear me? Hope I'm not making noise.
No.
I just on.
No.
There's no noise coming from me. I just on an AC or something. Hello, doctors.
Sure.
All right. So let's start with the cystode. The cystode, also known as what? What do we call the cystode, doctors? What's another name for cystode?
Tapeworms.
They are known as the tapeworms.
Tapeworms.
Very good. They are known as the tapeworms. Okay? The cystode are known as the tapeworms. Let's take note of that. Okay? And one feature you should know about the cystode is the cystode or the tapeworms always have head. They have head, and the head is also known as the scolex. So I'm going to show you a picture of that as we continue. So they have a head. The head is called the scolex. Scolex. And they also have a body, a segmented body, such like segmented body. We call it the proglottids. They also have the proglottids, I think so. Proglottids. So these are how I'm going to show you a picture now on how they look. Okay, hold on a second. Hold on, doctors. I want to share the picture with us so we can see how they actually look. Come in, I'm trying to share this thing. Okay, stop sharing. Share. Can you all see this picture? Can you see the picture in my front here? Can you all see this picture?
Yeah.
Yes.
You can see the head. This is the head. The head has something just around this place called the hook. Okay, they have something called rostrum here, and they also have, this is just the head, and they are divided into so many segments. They are called each segment is called the proglottids. So the proglottids is a very diagnostic features. Each organism or each cystode or each tapeworm has distinguishing features in their proglottids. So in diagnosing schistosoma or in diagnosing, sorry, I said schistosoma, in diagnosing tapeworm, the proglottis features is actually very important for us to take into consideration. Understand? So we are going to look at the proglottids. Am I making sense, doctor?
Yeah.
So let's
Yes.
move to our other share. So we'll go back to our normal whiteboard. So yeah, these are normal whiteboard. I believe everybody can see the other whiteboard now. Hello, doctors.
Yeah.
Okay. I'm trying to, so everybody can see. Yeah, we can all see it, right? So you have to note something about this cystode. one very important thing you need to know about them is they don't have GIT. So mostly they always attach to human being to feed or to survive. They don't have gastrointestinal tract. So they absorb nutrients from their hosts. They are from their host gastrointestinal tract. So note that no GI tract. So absorb no GI tract. So they absorb nutrients from where? From the host. Okay? So they absorb nutrients from their hosts mostly. Please let's take note of that. They absorb nutrients from their host. That's why some people, when they want to do this weight loss, they used to eat some of these cysts, some of these tapeworm. They believe like to control weight and all the rest. You understand? But just take note of that most of that is one of their features. And apart from that, another thing you need to know about it is their diagnosis is based on diagnosis. Sorry, I'm writing in capital letter. Diagnosis is mostly based on finding all these proglottis or egg in feces. So diagnosis is based on finding, let's say, the proglottis and egg in feces. Does that make sense, doctor? So that's how you mostly diagnose them. I'm just giving you an overview of the tapeworm generally before we start tapeworm in details. Do you understand, doctors? And don't forget, in some certain situations, normally we have definitive host and we have the intermediate host. When humans are intermediate hosts for some of these tapeworm, they are more serious and they are more complicated. So it's something that we have to take very serious. Do you understand? So let's talk about the first part we're going to talk about. The first tapeworm we're going to be talking about is the, let's start with the Taenia saginata, for example. Let's start with Taenia saginata. So Taenia saginata. Taenia saginata. So the Taenia saginata, doctor, is also known as what? Is this the first? I believe this is not the first time we are hearing it. We can use the chat box, please. The Taenia saginata is also known as what? Eh, doctor? Hello?
Different from Taenia Solium.
Yeah, it's different from Taenia. There's Taenia Solium, there's Taenia saginata, doctors.
Okay.
Is this the dog tapeworm?
You said?
Is it the dog tapeworm?
The dog tapeworm. The dog tapeworm is different, doctor. The dog tapeworm is the Echinococcus granulosus.
Roundworm.
No, roundworm is a group on its own, and there are lots of roundworms. Dr. Blue, you can join us. I want to hear from you. The Taenia saginata. The Taenia saginata, doctor. The Taenia saginata is also known as the beef tapeworm. You've forgotten. It's gotten from beef. It's also known as the beef tapeworm. Do you remember, doctors?
Yes.
Do you remember? It's also known as the beef tapeworm. Please take note of it. It's very important. Taenia saginata is known as the beef tapeworm. It's gotten from beef. So when you eat uncooked, how do you get it? When maybe you eat undercooked beef. So that's how you can probably get Taenia saginata. Does that make sense? So apart from getting it from undercooked this thing, what does it cause? What does it normally cause? What disease does it cause? Doctor, what disease does it cause? Any idea? It causes what is called, just go straight to the point. It causes intestinal tapeworm. We refer to it as intestinal tapeworm. There might not be specific symptoms, but it's mostly associated with all these chronic complication and chronic constipation and the rest. Okay, it causes intestinal tapeworm. Okay, so it might result into all this chronic, what's it called? Chronic constipation is mostly associated with it. Please, I want you to note all these major points. Understand, doctor? And what's the treatment of choice? How do we treat it? You know the diagnosis already. I don't have to go through the diagnosis. Mostly I told you the diagnosis generally is by finding the proglottis or egg in feces. So it's always definitive for their diagnosis. Do you understand? And the treatment is what? What's the treatment of choice?
Praziquantel.
It's praziquantel. We also use our anti-emetic drug, praziquantel. So this is the drug of choice we also use to treat it. Sometimes it can be asymptomatic, and sometimes it can present with abdominal pain. So you might see abdominal symptoms. You understand? So symptoms will be abdominal symptoms. Doctor, do you understand? It will be, let's say, symptoms will be mostly abdominal symptoms. Abdominal or let's say because sometimes most cases it could be asymptomatic. You understand? Only in certain cases you see chronic indigestion or you see abdominal pain. Just remember abdominal symptoms. Okay? Or we can just leave it. But in most cases they might have actually not ask you about this thing, but just know that it causes intestinal tapeworm and it causes intestinal symptoms. Let's move ahead to the next thing. Apart from Taenia Solium, another very important thing we also have is the Taenia saginata. What do I call it? Doctor, are you with us?
Yeah.
Oh, sorry, Taenia Solium. So what's another name for Taenia Solium, doctor? You can use the chat box. Another name for Taenia Solium is what? Doctor, I'm listening. Oh, somebody is using the chat box, okay? Pork tapeworm. Yeah, you are correct, Dr. Blue. It's also known as the pork tapeworm. Oh, sorry. It's also known as the pork tapeworm. It's gotten from pork, undercooked pork. Please let's take note of these names. They are very important. The Taenia Solium is pork tapeworm. It's gotten from undercooked pork meat. Okay? So that is Taenia Solium. So there's something that is very interesting about Taenia Solium. You know what is interesting about it is man is actually an intermediate host for Taenia Solium. And if you remember, I told you once man are intermediate host, the disease is always going to be very serious. I told you earlier before. You understand? Unlike the Taenia saginata, where the cystic the egg, is being ingested and you get infected, like that one is a different scenario where it's like one doctor just left or somebody just joined. All right, so we are still the same thing. So let's continue. So this one is actually more dangerous and more serious. Please let's take note of it. It's also known as the Taenia Solium or pork tapeworm. So the disease it causes is also intestinal tapeworm. So the disease causes what is called is an intestinal tapeworm. So you also see the clinical features of any intestinal pain, like or similar thing you will see. But one thing that differentiates this is because human is the intermediate host. Normally, for the other one that probably grows in the bee first, here, when you ingest uncooked pork, the pork gets inside your body. So, I mean, the parasite gets inside your body, Taenia Solium, the egg. So it assumes it's still inside a sheep, and it breaks forth, it hatch, it grows, it mature. It's like you're eating the egg. So when it matures, it finds itself in a new environment. And now it starts migrating, start moving anyhow. So that's why sometimes it can migrate to anywhere. It can migrate to anywhere. It can go to the liver, it goes to the brain. In most cases, it migrates to the brain. That is what is called, it results into neuropsychosis. Do you understand what I'm saying? I don't know if you have heard of that word. It refers to as neuropsychosis because it keeps migrating to different places. It's cysticercosis. So it is very dangerous. It's very dangerous. So you might be asking an exam, especially MCQ, which one causes neurocysticercosis or cysticercosis? It's always Taenia Solium. Please, doctor, don't let us forget. This is important because of when somebody is saying something, please repeat. I didn't get. Dr. Blue, which one didn't you get? I want to come again. Which one? Which part? Which one should I repeat myself with? About migration. Okay. Oh, to other part. Okay, it's like this. This is you are eating in Taenia Solium in pork tapeworm. you are the intermediate host. I'm using, I don't mean you, but I'm using human being, like you are the intermediate host. So what happens is when you ingest it, the parasite got inside your body and grows an ash and mature. So normally it's not supposed to be inside your body. So it's supposed to grow and mature inside the sheep and inside the pork, the pig. So now the parasite now assume is in a new environment. So it doesn't know how to migrate, doesn't know anything. So it starts moving erratically. It starts moving to different places. You understand? Now to the extent of it now migrating to the where? To the liver, to the brain. So now resulting into what is called neurocysticercosis. Does that make sense, doctor?
Yeah.
And Dr. Aisha just left. What's going on? What happens to this thing? What's happened to Dr. Aisha? I don't know. Oh, she's back. Dr. Aisha is back. So, Dr. Aisha, please, I believe you understand what I was explaining about neurocysticercosis. Please. So let's continue, doctors. Let's continue. So for the disease it causes and the treatment is mostly what? The treatment, don't forget, it causes also neurocysticercosis. It causes what is called, let's say, it causes cysticercosis. Cysticercosis, and resulting into neuro, because if it goes to the brain, mostly it goes to the brain. So neurocysticercosis. Don't forget, it results into this. Okay, so this is what is always mostly causes. And treatment, how do we treat it, doctor? Treatment is always use of you can use your praziquantel, okay, and you can do surgery, mostly surgery, and you use what's it called? You can sometimes they use bendazoles, but mostly you do surgery. You can do praziquantel. Same thing. You give praziquantel or surgical removal. Surgery. Let's say surgery is done. Okay. So that is the major treatment for Taenia Solium. Doctor, please, do we understand everything about Taenia Solium? And don't forget, I told you Taenia Solium is also known as the pork tapeworm. This thing I'm discussing are actually very important stuff. I want you to take note of it, please. So we continue to the other type of cystode, the tapeworm. Another type you have to know also is also called the what? It's also called the Diphyllobothrum latum. What do I call it? Diphyllobothrum.
Diphyllobothrum latum.
What is another name for Diphyllobothrum latum, doctors? Let's type. Diphyllobothrum. Doctor, I want to hear the other names for Diphyllobothrum latum. Anybody saying anything? No one is typing anything, doctor. Okay. So Diphyllobothrum latum actually do come out in exams. And another name for Diphyllobothrum latum is called the fish tapeworm. The fish tapeworm. Okay. It's also known as the fish tapeworm. Please let's take note of that. So that is Diphyllobothrum latum. So apart from that, what disease does it cause? It's also an intestinal tapeworm. It's an intestinal tapeworm. Don't let us forget that. But what it causes is when Diphyllobothrum latum gets inside your stomach or when you ingest it, it mostly goes and it absorbs the vitamin B12. So when it absorbs vitamin B12, it results into what is called the pernicious anemia, your megaloblastic anemia. It's very important because you might get a case or a question that which of the following causes B12 deficiency anemia is Diphyllobothrum latum. Please let note, also known as the fish tapeworm. Okay, so it causes it absorbs first. Let's say it absorb vitamin vitamin B12. So resulting into megaloblastic and anemia. Please don't let us forget. This is very important. It results into what is called megaloblastic anemia. And the treatment is also same thing. You give praziquantel also for the treatment. Praziquantel. Please don't let us forget, please, doctor. So this is Diphyllobatrum latum. It's also known as the fish tapeworm. You might be asked in an MCQ questions. You might be asked anywhere. Please take note of that, okay? So apart from the fish tapeworm, please do you have any question at this point before I continue? It shouldn't be as if I'm just explaining and nobody's getting what I'm saying. Any question, doctor, please let know. Hello, doctors.
No.
What about other doctors? Other doctors, any questions? Any questions? No questions. So we move, doctor. So the next one is the Echinococcus granulosus. Echinococcus granulosus. So Echinococcus granulosus is also known as what, doctors? What's the other name for Echinococcus granulosus? Any idea, doctors?
Dog tape.
It's also known as
Dog
dog
tapeworm.
tapeworm. Yeah, I said it earlier. Dr. Aisha said something like that. Echinococcus granulosus is known as dog tapeworm. Okay, so this Echinococcus granulosus, it causes a disease called Adati disease. In your surgery, you definitely have done something like that before. It causes what is called Hydatid disease. Hydatid. Yeah, Hydatid cysts. Hydatid cysts. So it's mostly once you ingest the affected organisms. Oh, okay. Wait, there's something I actually need to explain to you about Echinococcus granulosus. It is like this: the major host is very important to know this, because some might say because it is dog tapeworm, like the definitive host or the how am I going to explain it? Like the major organisms or the intermediate, the major organism is the the intermediate host. Sorry, is not actually dog. The intermediate organisms are amphibious. So if amphibious that is infected, if maybe any carnivores, when I mean carnivores, animals that feed on flesh or like dog, now eat the feces or eat any animals, any amphibious that is infected, that dog will now carry it. Does that make sense at all? I don't know if you are getting what I'm trying to explain, doctors. Hello, doctors. Do you understand what I'm explaining?
Yeah.
So now they might ask you tricky question that what is the intermediate host? And you go and say dog. No, the intermediate host are amphibious animals like cattle, like goats. So all those animals that are infected, if the carnivores now feed on them, so the carnivores that stay around where there's sheep, where they are raising cattle, that are infected, they are the definitive hosts. You understand? So the intermediate hosts are amphibious. Even sometimes human being can be the intermediate host in this situation. Does that make sense? Doctors, please, do you understand what I'm explaining? I want you to understand this thing. I don't know if we're actually getting it. Dr. Aisha, please, do you understand what I'm explaining? I know this might seem weird, but I want you all to understand it. So that is that about the additive disease. So the additive disease, they spread to the liver. They can go to the lung. There are different types. There's Echinococcus granulosus. There's Echinococcus multilocularis. The multilocularis most time goes to the lungs and the rest. And that one is even more dangerous. And Echinococcus granulosus is mostly in the livers, and sometimes it can migrate to the lung. And during the treatment, you have to be very careful, because once it breaks, it can result into anaphylaxis. So they always remove it gradually. I'm going to show you pictures of this thing. I have the pictures I want to share with you, so you can all know it, you can all see it. Do you understand, doctors? Let me see if I can share to the group chat. Hold on. Hold on, doctors. Hold on. No. Hello, doctor. Can you all hear me?
Yeah.
Okay. Can you see the picture? I'm trying to post a picture. Did he post?
No.
No,
No.
he didn't post. How do I post that picture? I selected the picture. There's a way they post picture on this Zoom thing. He's sending. I sent you guys one picture. You can see the pictures. You can see that is how it looks like apparently. Okay, you see this. It must not break when you are removing it or during operation. Okay, so that is additive disease, and mostly treatment is what you use bendazole or surgical treatment, surgical removal. Even after you remove it surgically, you still have to give the patient bendazoles. Does that make sense? There was a questions on this same thing in last exam, and the answer was actually sheep. Do you understand? Because everybody rushed to, I think, duct tapeworm, because they know Echinococcus granulosus is known as duct tapeworm. An MCQ question. But they are asking about the intermediate hosts. The intermediate hosts are ambiguous. Am I making a point, please, doctors?
Yeah.
Okay, and I told you about the treatment. Do I need to type again about the treatment? I believe we all got that. The treatment, okay, let me just type. Treatment is what? You use bendazoles, okay? You use bendazoles, or you do surgical removal. Same thing with Echinococcus multilocularis. Similar thing, same thing. The Echinococcus multilocularis, that one they call it alveolar adaptive cyst disease. Okay, let me just write it here. Echinococcus multilocularis, also known as the alveolar adaptive disease. You understand? So that is the same thing with Echinococcus granulosus, doctors. Please just take note of this, please. Echinococcus multilocularis.
Okay.
The problem about this is it's the cyst metastase. It can spread. The cyst can like very fast, very rapidly. Like there's metastasis. There's cyst metastasis very fast. And don't forget, how do you investigate in these two situations? Both Echinococcus granulosus and multilocularis. Here, you won't use the egg. Mostly examination is by imaging, by CT scan. And treatment is what? Surgical removal. Please, doctors, do you understand at this point?
Yeah.
So can we continue? Let's fire on, doctors. Okay? Let's fire on. So the next group of
We notice the cyst, right?
eh?
Right?
Oh, there's MCQ going on by 6. Apparently, it's true. There's MCQ going on by 6. You guys are right. I forgot, but actually, I don't know.
Let's finish this one.
We can't finish the parasitology today because I